Hi, my name is Matheus Martins, and today we are gonna be learning how to do cervical stretching, active release technique of the upper trapezius and levator scapula, and cervical traction using a towel. It's called manual cervical traction, but we use the towel. Okay? So first you position the patient in supine, and you see if she's relaxed. So she's relaxed, we can work. You touch, you feel it, see if there is any knots or anything. Ask the patient if they feel pain, right? Good. So then you have their heads, tell them to relax, and you have their heads. You put your fingers on the suboccipital line, and you you pull it a little bit, okay? So in that way, you're stretching the suboccipital muscles, right? A little bit of the sternocleidomastoid and the scalenes. So now you place your hand on the suboccipital line, and you pull it to the side. With the other hand, you stabilize the upper trapezius on the left side, and in that way, you're stretching the left upper trapezius. You hold it there for 30 seconds, right? And the right thing to do, you were supposed to do it 3 times. And then, same thing, you do it on the other side. You feel the stretch? Always ask the patient if they're feeling the stretch, because sometimes you can bring them a little more. Right? Okay, those are the stretches for the upper trapezius. And now what you're gonna do? You stabilize the head with your right hand. You cross the left to the shoulder. So you stabilize the shoulder, make them relax, and now you pull their hand to the left side in order to stretch the right levator scapula. So you hold it there for 30 seconds again. And you release it. Same thing on the other side. Cross your hand. Relax. And with the other hand. See the stretch?
Mira, y eso es un eBay.
So you turn their head to the side to stretch the sternocleidomastoid. Bring it to neutral, and then turn to the other side. A little bit of cream.
You want to start with the right side?
Ahorita ya.
Se pone un pechero, ¿sí? Le pone el pechero, un wire.
Okay, so here what you're gonna do, you're gonna shorten the muscle, right? You're gonna press, and you're gonna pull. So you shorten, you press, and you pull. Your finger doesn't move, it stays there. What is gonna move is the muscle. The muscle is moving. And you're releasing the muscle, right? So So you go like that. That's the release for the upper trapezius. Relax. You can do it active, the patient can do the movement, or you can do it for the patient. In this case, you're doing passive, so I'm doing the movement for the patient. And if you want to do the levator scapulae, you start all the way up here, right? And you do the action, which is flexion to the opposite side, right? And you go all the way to the middle angle of the scapula. So you do it on both sides. So you do it on both sides, you release it a lot. And after that, what are you gonna do? You're gonna apply the towel. You roll the towel. If the patient is able to lift their head a little bit, you tell them to lift their head. But if they are not, you just pass it underneath their head. You cross the towels. Sometimes if they have big ones, you tell them to take it out. If they don't have big ones, you just turn the towel. And cross in here. So the pressure won't be too hard. You hold it here. Right? So now you have the control. And the other hand, you place down. So you ask the patient to breathe in and breathe out. As the patient breathe out, you pull it, okay, with a minimal submaximal force, and you hold it there. You can hold it there for 30 seconds and release it, or you can hold it there for 10 seconds, release for 5, hold it for 10, and release for 5, like an intermittent manual traction. So you hold it there, and then you release. After you release, you ask the patient to turn to the side, to one side, and then to the other side. Ask if they feel pain, and if they don't feel pain, you do it 2 more times. And that's how you do stretching, ART, and cervical traction of the cervical spine.